Can you start by pointing to where it hurts, where you feel it?
Mostly here.
Okay.
Feels like the source or the base, I guess.
Okay.
And then it definitely goes up into my jaw.
Uh-huh.
And then like
Okay.
down.
Okay. So it's all on the right.
Yeah.
Can you describe the sensation? What does it feel like?
Like a tight rock.
Okay. Is there shooting pain?
No.
Okay. Numbness, tingling in the arm or hand?
No.
Okay. Good. And does it hurt worse to cough or sneeze?
No.
Okay, good. So I'm feeling like your right shoulder is really tending to protract like that. And your right collarbone here is elevated. And it's like the tension here is pulling it forward and up like that. So I'm going to try to kind of induce a little bit of a better position here and see where the resistance really is. It's really coming, a lot of resistance coming from right here. So right around T1, 2. And can you look down, like chin to chest? Good. Good. And can you look up all the way? Great. Come to neutral. I want you to turn your head to the right and to the left. Okay. So your range of motion is basically normal, pretty much full, but it's not as easy as you'd like. And yeah, again, it's right in here where we're going to want to be able to induce a little more mobility. Good. Great job keeping your neck relaxed for me, Emily. Okay. So I'm going to turn your head for you so I can feel the upper cervical vertebrae where most of that rotation takes place. It's actually feeling pretty good. But the occiput here on the right is tending to misalign in this direction. So it's nothing injured, it's just a little cranky because the alignment is not great. You feel that right there too. Yeah, it's a little stuck. Okay, I'm going to come around the front. We're going to look at your jaw. So give me a gentle clench. And then open wide. Good. Close. So I'm feeling the body of your mandible here and the angle here. And go ahead and open, and I want to feel, can you go any further? Ah, there you go. Okay, that's actually moving pretty good. There was a little click. Come closed and open. Okay. I feel that tension here. Okay, we can work that out.
Yeah.
Okay.
And it's less like in the joint.
Yes.
And more here.
Down.
This really tight and stiff.
Got it. Yep. All along the mandible here, not so much in the joint. Got it. Okay, so I think our strategy here today is to work this and up and over and jaw. And so that's what we're going to do. So yeah, starting skin level, we don't want to miss any layers. We want to remember that the lower trapezius, which really affects the scapular position, originates all the way down here at T12. And we're looking at the lat and the serratus, always interested in what's going on in the side body when it comes to shoulder stuff, because we haven't really yet identified what's causing Emily's body to adopt this position. We've kind of identified the pattern, but not really the genesis. So we want to be able to keep the lens open and try and gather as much information as we can while we're palpating, assessing, and treating all at the same time. Good. Good. Thank you. Okay. So what I feel is some tension here on the side ribs, definitely some tension on the lower scapular stabilizers, but really the most stuckness right here in her upper trapezius, levator scapula, right there. So I'm here inducing some inferior glide of the scapula And we don't want to just get it to retract. We want to get it to slide back and down. Yeah, like that. Getting a little bit of movement there. And definitely feeling like what's happening here is really affecting the right side of her neck. There's a lot of tension on the levator scapula right there. Good. Coming into the AC joint here, and because that clavicle is kind of stuck, that's showing up at this end of the clavicle in the AC joint. But we're not going to spend too much time there because I think all that is really coming from what the upper trap and the levator are doing. That really so far does seem to be kind of the center of the issue. Good. So getting a little traction through the shoulder. Good. And good. Teeth gently together. Good. And then relax. So we start with the mouth in neutral, which is teeth ever so slightly apart. And I'm just going to kind of get the lay of the land here. Got my finger up in the corner where the TM joint is. And now I'm pulling out laterally on the masseter, tractioning that masseter, giving it a little stretch, a little counter pressure from my thumb on the outside. And as you can see, I'm just really slowly moving that grip inferiorly toward the body of the mandible. And it's a little traction upward with my left thumb so I can get a little stretch of that fascia of the temporalis muscle. Good. Okay, Emily, open slowly. Good. And so as she opens, everything stretches a little more, and we give it a little stretch. Good. And then come closed. And we're going to do the same thing now with my finger just a tiny little bit deeper in. So I've got more of the masseter now in between my pointer and my thumb. So open. Yeah, I feel a little knot right there. That's good. Just slippery knot right under my finger. Good. And relax. Do you need a break? Okay, good. Let's do it again. Open nice and slow. Good. Well done. Great. Good. Okay. So finding some definite deep tension as I traction. Good. Okay, let your teeth come together and open one more time, nice and slow, all the way. Good. Great. Okay. And let that relax. Ooh.
Yeah.
Is that enough? Did I get it?
It feels way better.
Okay, good. And this side, it's always intense, this treatment, but it'll be less intense on this side. So whenever you are ready, you can just let me know. Open your mouth. Take as much time as you need. Okay. Teeth. And whenever you're ready, open and open it all the way nice and slow. Definitely feels different on this side. Not as tight. Can you keep going? Good. Good. A tiny bit more if you got it. Okay. And then relax. Good. So these two fingers giving a little bit of a pinch to traction that masseter down. This thumb from the outside on the temporalis fascia tractioning up. Open again. Great. And whenever you're ready, give me a nice big slow opening. Good. all the way. Nice. Good. One more time. All the way open. Good. Okay, bring your jaw back to rest. And a little superior traction with my right thumb on the temporalis. Feeling like that's necessary. So next we can really see a little asymmetry here of the clavicles. Not something you'd notice unless you were looking for it. Let's get your palms up and just a little bit like that. I want you to take some deep breaths up into your chest. Good. And then let it out. Great. Okay. Definitely holding some tension through the upper body. That's why we're here. So here I'm giving a little traction to our occiput with my left hand, while with my right hand I am sweeping up the paraspinal muscles, getting a little movement. Okay. I do think that we want to adjust your neck today. Yeah. Okay. Good. So nice, easy breaths here. Good. Really good. Mm-hmm. I'm not going to surprise you. You're going to know. Good. Okay. So we just got a nice little release from that right upper SCM, which is going to help get that occiput in a better position, which is going to help release a lot of the tension in the whole neck here. So let's do the same thing here on the left side. Coming up along the SCM. So I've got it between my fingers. And as I'm stretching that SCM, I'm trying to induce better position of the occiput, which means a little traction on the left here, because it came a little inferior on the left, a little superior and lateral on the right. Good. Nice. Yeah. So you can see I'm giving a little stretch to these suboccipital muscles now, like very specifically. Right in there. That can feel pretty intense. Bring your head to the left a little bit, okay? I'm going to finish off with a little cranial work. Yeah. So I'm symmetrically here, lifting on the temporalis, pulling it toward the crown of the head. As we're holding tension in our face and our jaw, it does tend to kind of pull on that temporalis, pulling it forward and down. So I want to counteract that a little bit if we can. And the same, really gently on the forehead. Thanks, Emily.
Thank you.
I appreciate it.